Who is the ideal candidate for breast filler, breast thread, or non-surgical breast augmentation? This is a very frequent question. All the girls who have small cup size genetically, or who have petite frame, small frames with small cup size. Number three, all the women who undergo breastfeeding during after the childbirth, and frequently breastfeeding mothers are found to have loss of collagen in their breast tissue. Number four, all the women who are uh, losing and gaining weight constantly, either due to weight fluctuations or polycystic ovarian syndrome or insulin resistance or some kind of obesity in their genetic material. And largely I have seen women in Pakistan trying to get rid of their pregnancy fat all the time. So when you are gaining fat and you're losing fat and you're trying to maintain the weight, there is a lot of fluctuation in 3 to 4 babies. So you are supposed to lose the breast tissue in the process while you are losing weight without proper muscle training. And usually the way I have seen women are trying to lose weight in Pakistan, and women I meet frequently, I have seen that these women are losing weight by calorie deficient diets or low carb or keto or God knows HCG and whatsoever. So primarily they are not working on their muscles. So when you're not working on your muscle and muscle training, then you are supposed to lose weight from your breast. And number five, those women who are suffering from breast cancer, or they have any kind of fibroadenoma, benign or malignant breast cancers. Once they appear in our clinics, what we do is this, that usually we don't remove fibroadenomas and we try to keep it intact because it is usually benign. But histopathology is always a must for all the clients. But I have seen that many of the fibroadenomas, they are like of big sizes. When they grow to a big size, they become a problem for the woman to carry them. So we have to remove those fibroadenomas, and aesthetically and cosmetically, that leaves them with half breast or quarter part of the breast has been removed. So those women are very good candidates for proper breast filler, threads, and all the non-surgical procedures, which we have to customize the plan. We cannot just say that all the fibroadenomas are going to have filler, or all the fibroadenomas removed from right or left breast, they are going to be having fillers or threads. Number five, all the women who have undergone mastectomy by breast cancer, once they have been uh, through a surgery and they are done with their chemotherapy and they are done with the all the protocols of cancer, and they are free from the oncology department, they show up in our clinics, and then they have this problem that how to now fix it aesthetically for the confidence and self-esteem of the woman. So these are all the areas which are very now in this era we have all the solutions for this for these kind of women. Previously what was happening is this, that all the women who were having small cup size, or all the women who were having like genetic problem, and their husbands are telling them that they want some good size breast, and this is a constant problem in their household, and this is a constant debate because women come to me and they tell me that this is a big issue for her husband and he wants that. So once in 20, 30 years back, if we look back retrospectively, what I find now is that women are equipped with a lot of new options of non-surgical breast lift as compared to 20 or 30 years ago. We only had this breast implants. The only option which was ever offered to me or to my cousin or to my any of my friends was you should just have to go to a plastic surgeon, or you can get a breast implant. what happens in breast implant and what are the problems which I have seen in last 20 years with breast implant and breast surgeries is this, that number one, there are a lot of qualities of implant. So once you sit with the plastic surgeon and you decide that, okay, this is my cup size and I want to, this is my body frame, and you and the doctor, they both comes to a point that, okay, fine, this is the cup size, you are 32B and we are going to 34, double D or double C. Then comes the point where you have to purchase the implant. An implant has to be purchased by the client or by the patient, not by the doctor or the hospital. So then doctor gives you a, yeah, a wide range of breast implants, like starting from Chinese and Korean to German and French and Swiss and European and USA. And the price range and price tags are very high, starting from somewhere 4 lakh or somewhere where 4 lakh to 15 lakh to 10 lakh. So now the question arises that what should I buy? Which is the preferred one for me to buy? This is a very important question for the candidate. The answer is very simple, that when you pay for a good product, the chances of infection are less and the chances of implant rejection are less, which is, I think, highly neglected in a lot of clinics and a lot of practices, because usually the approach of a woman when she approaches a plastic surgeon or a breast surgeon or an esthetician, or to me, to my team, we are doing breast implants as well. The real problem starts with this approach that I want the cheapest. So when you go for the cheapest product, it is pretty evident that the cheap is going to give you a lot of problems, a lot of post operative complications. So although in a lot of clinics they ask you to buy the cheapest, it's okay, we are good with it, we will sort it out, all is well, don't worry, I'm doing it every day, I'm doing 100 cases a day, and sweet customer, you don't have to worry about that, I'm here for you. But it doesn't happen that way. Number two concern which I have seen in last 20 years is that you have opted for, like, the picture presented to the customer is like that you just buy an implant, you buy the cheapest one, okay, it's fine, you just admit, come to the hospital, get admitted, the next year you are going to have a surgery, and by the evening you will be home. And at times I have listened that doctors are telling the clients that, okay, you can take the flight in in the evening, and it is a very pretty picture which is being presented, and I think it must be happening in a lot of cases. But here the purpose of this video is to tell a normal customer that what are the things which can probably go wrong. And I am the sole witness of one of these cases in my family, that my first cousin, she got implants, and what a nightmare we went through as a family, and what kind of horrific experiences we had to face. So number one, we bought the implants, and the doctor said it's okay to buy the cheaper. And she was like this, okay, the cheaper is good. I will be left with a lot of money to spend on my clothes and my jewelry and makeup. And that was the worst decision, I think, because she was supposed to, if I was that much learned and that much literate and that much knowledgeable 20 years ago with her, in that during that surgery when I was accompanying her, I would have told her, either you buy the most expensive or you don't do it. You don't have to go under knife. You don't have to get it done, because the more cheap product you buy, there are more and more chances are there that, because it is an implant, the word is telling that it's something exogenous is going to be implanted in your body. And if it is going to react, you can understand how a transplant rejection happens. It's an outdoor implant which are we are borrowing something made up of silicone, and it has to be settled down in your body nicely. So if the silicone is of high quality, if hyaluronic acid being used is of very high quality, if the whole cup, the whole silicon, the thing you are handling in your hand, it is of the highest brand and highest quality. Only and only then there are chances it is going to be, you know, settle down in your body properly. It is going to give you less complications afterwards. So how does an implant rejection sounds like? That is the next question which you should ask. And nobody is going to tell you this in the clinic. I am telling you, very, very, very solidifying this opinion, because I was with her through all this process with my cousin and then with another cousin. Because whatever issues she had, we don't want to go into the details, but the point is this, that we were told, buy the cheapest, opt for the cheapest, go for the cheapest package. The point is just to book a surgery as early as you can. The second way is this, that you can tell the candidate that, you know I think you are like 40. I think you should opt for the best one if you can afford, or you go home and think about these two, three options. And if I am the surgeon today, I like to enforce my client to go for the better quality. I don't like offering Chinese, Korean, and these kind of implants which are going to give problem to my client afterwards. So how does the reacted implant or rejected implant or implant rejection sounds like? That is a very important question, because once you go through in the implant rejection phase, I saw my cousin and me, we were suffering alone. The rest of the whole team just vanished or out of the picture, and they were not at all ready to take any kind of responsibility for that thing to happen. So I will explain you everything in detail about, and let me be very clear that silicone implants are different than breast fillers. Implant is a cup, is like a cup, which my team is going to add some Photoshop pictures on by the side of my video on the screen, so you can understand the difference between the implant and the difference between a breast filler or the non-surgical rest of the treatments which we are offering. Okay, so we were at the plant rejection. How does a plant rejection sound like? Number one, there will be a fever, non-stop fever. You will never be out of the fever. It will start from the night of the surgery, and they will start telling you, okay, it will go away in 3 days. Okay, it will go away in 2 days. You will, if you don't have fever, you will have body pains. You will have like inflammation. You will have the signs of hyperthermia. Like you will feel that I am something is heating up. The signs of inflammation always show. So in the first week, normally the surgeon or the plastic surgeon or the doctor, they all keep on telling you that it happens after the surgery. We are going to give you Panadol or Panadol infusion or Flagyl or whatever. They increase the dose and all that. But after a week, you will start seeing that pus starts coming out of the breast, and that pus is never going to stop. The more you squeeze it, the more it comes. And then after a week, I think week, me and my cousin, we were like done, and we uh, went into the doctor's clinic. We took an appointment because he was not picking up the call. And what he did was that he's a very renowned surgeon, by the way. I don't want to take his name today here. And he is very famous in Pakistan, most importantly in Punjab. But and the very unfortunate thing was this, that we trusted him a lot. We trusted him a lot, and he actually removed the report of histopathology from the lab. The pus that started coming out of the implant, that was taken to the laboratory, and we insisted that we want to take it to some outdoor lab or some other lab, not the lab in the hospital. But he was like adamant, no, I want to send it to my own laboratory. I want to, I have a trust in their equipment and all that. And the next thing we knew, that when we were there to pick up the report, there was no report. They said somebody has taken it and it is not in the system. There is no duplicate copy. And the next thing he did, He inserted two big tubes in the chest, which were associated with two large bottles, like mirror की जैसे bottle होती है ना, like हम bottle इतनी बड़ी शीशे की bottle, glass bottle, suction bottle, and all day the pus used to come through those pipes into those glass bottles, and my cousin was carrying it like those two pipes all day with a big operation theater gown wherever we were going. She was like that for 3 weeks, and then everything was paid. Whenever we go back, we had to take an appointment from the operation theater, because they used to press the pus out of the breast implant. It was a very terrible, very painful procedure. She used to cry a lot, and they used to push the pus, and every time we had to pay 40 to 50,000 for that one dressing change. And then she had that inserted, and it took her like 1 month to remove that pump. And even after that pump was removed, the pus was still coming. And then I called on like a lot of doctors abroad, and we had like our own board, because the doctor was not at all cooperating. He was not picking up the call, he was not listening. And the doctors told us that when the implant undergoes this kind of rejection, it is the most important thing is to remove the implant rather than insisting and trying to keep it in your body and trying to overcome the infection with a lot of antibiotics. You have to remove the implant. So she got it removed from somewhere abroad, and this whole episode taught us a lot of things. And number one, never choose cheap. Number one. Number two, uh, there was one conversation with that plastic surgeon which I had, because I was a medical student then, and I asked him that, as per my knowledge, the operation theater, in the hospital which you are choosing, in this particular operation theater, there are a lot of surgeries undergoing all the day, like orthopedic surgeries, C-sections, hysterectomies, hysterotomies, and then name it, the brain surgery or ear surgery. And that was a general OT. The hospital had no separate operation theater for plastic surgery, and the kind of operation theater in which a lot of surgeries are undergoing, like multiple organs are opening day in, day out, and no matter how much you undergo sterilization, how much you follow the standard operating procedures for the sterilization, the chances of infection, taking an infection from the operation theater, are much much higher as compared to in an operation theater which is only and only allocated for plastic surgery and the procedures taken undertaken for plastic surgery.